Thank you, Madam Chair. And I'd like to thank Congressman Cole, our ranking member, for his leadership on this very, very important piece of legislation. And Ranking Member Granger as well for your leadership on this. It is a very passionate issue for so many of us. And I am proud to co-sponsor this amendment with my colleagues on the Republican side of the aisle. Madam Chair, I rise today in support of the Hyde Amendment, this very important pro-life amendment offered by my dear friend and colleague, Mr. Cole. I rise today in support of the unborn. I rise today in support of women, babies, girls yet to be born into this world who deserve every single opportunity that we in this room can give them. I rise today in support of the women who need encouragement to choose life, not coercion to end it. I rise today in support of the American taxpayer who does not want to pay for elective abortions with their hard-earned money. I rise today in support of the doctors, the nurses, and other healthcare professionals who are called to defend on life and should not be discriminated against for their beliefs, for following their conscience. I rise today in support of life, liberty, and the pursuit of happiness. And I rise today in support of the Hyde Amendment and the Hyde-Weldon Amendment, which have both enjoyed long-standing bipartisan support for decades, for longer than I have been alive when my mother chose life. I rise today in support of the 2.5 million lives that the Hyde Amendment's enactment has saved since 1976. And I rise most importantly today to be a voice for the voiceless, to defend the innocent, and that is exactly what I intend to do by adding my voice to this conversation. As my colleagues have already explained, this amendment is very simple. It's always been simple, and that's why it has enjoyed such bipartisan support. I'm not going to stand here and reiterate those points, but I think we should point out again what we've already talked about today is that all my colleagues on the other side of the aisle have already voted for this, supported it. I could go here state by state reminding everyone how many lives Hyde has saved in those states. In my own home state of Iowa, by the way, Hyde has saved about 40,000 lives, 40,000 babies, including 443 babies just this year. Madam Chair, it saved nearly 3,000 babies in Connecticut. And Mr. Subcommittee Ranking Member, Mr. Cole, you'll probably be interested to know it has saved about 47,000 babies in Oklahoma. I'm sure each of them is thankful for your leadership on this issue today. But this is about more than numbers. This is about the fact that Hyde does save lives. And even if we don't know the numbers, it's important to remember why we're here in the room today, which is to represent the will of the American public. And nearly 60% of Americans oppose taxpayer funding of elective abortions. The number is startling, and I know many of my colleagues have already pointed to that number today, but I think we should take a minute to break it down further. The poll was conducted just this year, so we're not talking about Americans of the past, of the 1950s. We're talking about 2021. Americans today, and 60% of them oppose using taxpayer dollars to fund abortions. So I think it's time we respect the will of Americans. These Americans are sitting around their kitchen tables right now worrying about paying their bills. They're worried about their jobs. They're worried about their loved ones, especially coming out of a devastating pandemic. They're worried about getting a spot in childcare. They're worried about putting food on the table, keeping lights on, and making ends meet. Those are the real kitchen table conversations happening in Iowa and around the country. They're working hard for their paychecks, and they hold strong convictions, much like most of us in this room. But what an absolute slap in the face to the millions of Americans who are working so hard and strongly oppose elective abortions to tell them, hey, you know what? We know you're struggling, but we are going to fundamentally force you to do something you don't agree with. Send your taxpayer dollars here to Washington, and we're going to use them to pay for this horrible act that you oppose. That's just wrong, and it's reprehensible, and I'm frankly ashamed that we are even having this fight today. And I want to turn now to the second part of this amendment, which is common sense and foundational to our views as Americans, which is the freedom to exercise your beliefs, and that's the Hyde-Weldon Amendment. It's a classic non-discrimination provision that's been enacted every year since 2005. All it does is prevent the federal government from discriminating against healthcare providers because they refuse to provide abortions. And we're talking about Americans' basic rights to live out their lives and beliefs without the heavy hand or reprisal of federal government. Forcing doctors and nurses to go against their conscience is un-American. And while we're on the subject about conscience, not health care, because elective abortion is not health care, Plain and simple, elective abortion is not health care, and doctors and nurses should not have their rights trampled for it. We talk a lot about civil rights here, but this place does seem really eager to throw them out the window when it comes to abortion, and I believe we are better than that. So instead, I'm going to try to appeal to your conscience today because that is what is guiding me in this fight. I can tell you, as a mother of 2 boys, Max and Jax, I cannot imagine a world without them in it. They're my boys. And I think all of us should consider the worth of our own mothers to make that decision to bring us into the world. I am grateful that our mothers all chose life and we're all in the room today together. And that's why I'm going to be voting yes on this amendment today. So again, I can get you the data, I can get you the numbers, but we have the facts, and that's what this is about. But if it's about what's right from wrong, I can't really help you with that. That's your own personal choice. That's your conscience. But I think what I can tell you is that I know life is precious. It's worth fighting for. The American taxpayer is with us on this. The American taxpayer is worth fighting for. And I'd encourage you all to respect that taxpayer. Let's honor the taxpayer's wishes. Let's not use their money for elective abortions. And let's not silence and punish our healthcare workers who are following their own conscience. The Hyde Amendment saves lives. So let's save some lives together here today. Thank you, Madam Chair.